The following show is for educational purposes only. It is not intended to diagnose nor treat any medical condition. Any information or recommendations provided should always be discussed with your healthcare professional. I'm Physician Assistant Frank Smith. Welcome to the Patient Talks. On today's episode, we're going to be discussing gallbladder disease. If you already have a diagnosis of gallbladder disease, you don't need me to tell you the symptoms. You've already become an expert at them. But one of the most common questions my patients with gallbladder disease will ask is, why do I even have a gallbladder? And if I need it, what happens after my gallbladder is gone? So we're going to be covering that today, what your gallbladder does and how your body makes adaptations after it's been removed. As always, we're going to start with some basic anatomy and physiology. In order for our bodies to absorb the nutrients from all the different foods that we eat, there are multiple processes involved in digesting those foods. It includes salivary amylase, stomach acid, lipase, and there's a substance produced by the liver called bile. Bile's job is to emulsify fats. Now in English, all that actually means is bile takes the larger globes of fat and starts to break them down smaller and smaller until they're microscopic sized. Bile essentially does the exact same thing that dish soap does. Dish soap breaks down fats and oils so that you can clean your dishes. Well, bile's job is to break down fats and greases to where they're small enough that the body can metabolize and use it. The liver produces bile at a steady state. Imagine that there's just a drip, drip, drip coming from your faucet, and that's about the rate that liver produces bile. However, we don't eat fatty or greasy foods at a steady state. So we need a reservoir of extra bile available so that when we do eat, that can be sent into the small intestine to help break down those fats. Tucked up under your liver over on the right side is a small little sac about the size of your thumb, and it's the reservoir for bile. Now, once upon a time, the name for bile was gall, and another name you could use for a sac is a bladder, gallbladder. So that's its job, is to work as a reservoir of extra bile so that when we eat, we can shoot that into the small intestine to help break things down. What can happen with some people, however, is little bits of sediment start to form within the bile. And you can start to get a hailstone effect where little by little they get bigger, and you can end up with an accumulation of stones within the gallbladder. When the liver receives the signal to contract, to send bile into the small intestine, you can imagine that crunching of stones coming together, and that's what causes the substantial pain that's involved with gallbladder disease. Sometimes one of the other things that can happen instead is there's not actually any stones within the bladder, but the bladder walls become thickened and hard. A nickname for that, or an old name for that, is called porcelain gallbladder, and it's just where it doesn't do its job. So that's the reason you even have a gallbladder. At which point the next question becomes, okay, Frank, I get it why I need to have a gallbladder. So what happens when I don't have a gallbladder? It's a very good question. Our bodies are built to adapt. It's the reason that you're able to donate a kidney or actually have part of the liver excised. The body is able to adapt to that. When you've had your gallbladder removed, the liver, instead of doing a steady state of just a constant little drip of bile, starts to adapt to that. And what it will do is when we haven't eaten, the rate of bile production slows way down. And when we eat, bile production increases dramatically to compensate for that loss of the extra reservoir. So that's going to do it for this week's show. That's the ins and outs of why you have a gallbladder and why your body is able to adapt afterwards. If you've enjoyed the show and found it informative, please click the like and subscribe button down below. I'll be back next week. Until then, get better and make me look good. Have a good week.